In this video, we'll discuss about syphilis, which is one of the most commonly asked questions in exams. Also, we will discuss it under headings and in context to general medicine. So, let's start. So, coming on to the definition, it is actually classified as sexually transmitted disease, and it is a chronic systemic infection caused by Treponema pallidum. The incubation period is 2 to 4 weeks. Now coming on to the epidemiology. Now it is more common in the age group of 16 to 35 years, and it is very commonly seen in sailors, in prostitutes, in army servicemen, entertainers, homosexuals, and travelers. Now the mode of infection. Now first of all, as it is a sexually transmitted disease, so we will definitely talk about the sexual contact with infected lesion, which is canker or chancre, mucus, patches, skin rash, condylomata. Then second is through non-sexual contact. Example, we can talk about personal contact, kissing. Then we will talk about it being transmitted from the mother. So basically transplacental. From infected mother. Also by transfusion of blood and blood products. Now let's talk about the pathogenesis. Now first of all, suppose this is the mucous membrane and this is our blood vessel, so bloodstream. Now what you will see is the Treponema pallidum. It enters then it will cause systemic infection followed by secondary syphilis, which will change into the latent syphilis. Now in latent syphilis, it is of two types: early latent and late latent. Now the early latent is the one which takes less than 2 years, and the late latent one is which takes more than 2 years. Alright, then it will convert into the or it will progress into the tertiary syphilis. Now tertiary syphilis will further convert into the quaternary syphilis. Now in quaternary syphilis, we basically have two systems that are affected. One is the neuro and the second is the cardiovascular. Now here what will happen is, I forgot to mention, there is going to be primary syphilis, that is there is going to be primary lesion. Now as I told you, primary lesion is always a chancre, alright, and it will persist for 3 to 10 weeks, and if it remains after that, then there is progression. Now sometimes what happens is around 25% they actually they relapse. The patients, they relapse from the latent syphilis to the secondary syphilis, alright. So in this we can write about neurosyphilis. Okay, neuro alone looks weird, so neurosyphilis. So now let's talk about the classification. In classification, first of all, we have the primary syphilis. Then we have secondary syphilis. All right. Now in the primary syphilis, what we see is that it is or and secondary syphilis, and then we have the latent syphilis. All right. Now we can see that all these, they occur at the early stage. Then we will talk about the late stage. Now in late stage, either it can be it is basically a latent syphilis, but late syphilis, and the tertiary syphilis, the quaternary syphilis, and then again the neuro and cardiovascular. Okay, neurosyphilis and cardiovascular. Now let's talk about the clinical features. Now clinical features, there are basically acquired types and the congenital type. All right, so we will first discuss the congenital type, and then we will come on to the acquired type. Now in the congenital syphilis, we will discuss the lesions in three categories basically. So the first one being the early congenital syphilis, then the one being the late congenital syphilis, and then the stigmata. All right. Now in early one, we will mention about the maculopapular rash, mucus patches, condyloma lata, hepatosplenomegaly, then we will talk about the fissures around mouth, nose and anus. Then we will talk about the choroiditis, then periotitis, meningitis, thrombocytopenia, anemia. Now in late, we will discuss about some severe ones. All right, so first of all, we will talk about periostitis, then benign tertiary syphilis, then parazoximal, cold hemoglobinuria, then interstitial keratitis, eighth nerve deafness, Cluton's joint. Now in stigmata, as you all know, all the famous lesions of syphilis will come. So some of them you might already be knowing. So Hutchinson teeth, then Mulberry molars, then Bragade's formation, high arched palate, saddle nose, maxillary hypoplasia, salt and pepper, scars on retina, then corneal ulcers, Sabre tibia, also then bossing of frontal and parietal bone. Now this completes the congenital syphilis. Now we will talk about the acquired syphilis. In acquired syphilis, primary, secondary, and then tertiary, or basically latent, right? Now in primary, as I told you, you see a chancre. It remains for 3 to 10 weeks. All right. Then it usually occurs in genital area, the anus and mouth. Initially it is a painless macule which converts into a papule which undergoes ulceration. Alright, so in secondary, what you see is a maculopapular rash. Also in this you will see regional lymphadenopathy. All right. Yeah. One question that is asked so many times in the MCQs and in Viva. In syphilis, now what you see is the nodes. Now they are shorty. So you must remember this keyword. Okay, shorty lymph nodes. Now over here, maculopapular rash in secondary. Then anal condyloma lata. Then snail track ulcers, lymphadenopathy, CSF. It will resemble that of meningitis. All right. Now in the latent one, there is early and there is late. Now this is basically non-infectious. The early one is very diagnostic. What happens is, in early we see a 4-fold rise in titer, whereas in late there is no as such diagnosis that can be made, and it can only be made by conversational methods. Now coming on to the late syphilis. In late, it is divided into tertiary and quaternary. Now in tertiary, you must mention gamma. Gamma is the keyword here. As chancre is in the first one, then the gamma is in the tertiary one. Now it basically is very slow and it takes around 10 years to develop and so on. So quaternary mein I told you about neurosyphilis and cardiovascular. Now in neurosyphilis, you must remember certain keywords like meningio-vascular, Tabes dorsalis, and general paresis. In cardiovascular, what will happen is you will see aortitis, you will see the calcification. All right. Now let's talk about the investigations. In investigations, first of all, as we had read in microbiology also in the second year, we do dark field microscopy. Then there are certain tests that are specific and certain non-specific. So for the non-specific ones, we have VDRL and RPR, rapid plasma reagent test. Okay. In specific, we have TPHA, FTA, TPI, EIA. All right. Then we can also conduct some RIA, radioimmunoassay based studies. Now let's talk about the treatment. Now the primary, secondary and the latent. Their main treatment is procaine, penicillin, 600 to 1200 milligrams for 10 to 14 days. Also what we give is benzathine, penicillin in 1 million units, that is 2.4 million units for 4 weeks. Now in benign tertiary syphilis, we will give the same dose, right? But what will change is the time. The procaine penicillin, it will be given for 4 weeks, and the benzathine penicillin G will be given for 3 weeks. Okay, so just mention it. If now the person is allergic, then we give oxytetracycline 500 milligrams 6 hourly. We can also give doxycycline. All right, then we can also give ceftriaxone. Then the similar thing here also you can write about. In differential diagnosis, what we have is herpes simplex, then erosive balanitis, then traumatic genital ulcers with secondary infection, then scabies, secondary syphilis. Now why secondary syphilis? It has a number of types of rashes. So if you see a macular rash, you can consider it to be caused due to a drug, or due to some rubella infection, or due to skin infection. Then if it is papular, it is due to drug, acne vulgaris and scabies. Alright. Now if it is condyloma lata, then viral wart. Now if it is oral ulcer, now it can either be due to the gingivitis, ulcerative gingivitis. Then it can be recurrent epithelial ulcer as well. Then it can be due to herpes simplex, also granulocytosis. If there is lymphadenopathy, then there are very common reason for lymphadenopathy is the infectious mononucleosis. Also, so many. I will also make a video on short note of lymphadenopathy. You can go and watch and then mention it here. So I hope you liked this video and actually understood how to attempt it, and I made it obviously easier for you to understand. So thanks for watching. Do subscribe, like and share, comment. Just do what makes the algorithm run. So thanks for watching.